this time frame, given that the pandemic was really spreading fast. And so we turned to our partners, namely Jumuiya, their county Zwapani, and also through them to Pwani University, with whom we already had an existing partnership, to conceptualize a program that can be taken up by our healthcare workers, especially given that one of the largest incidences or spread of this disease is at the coast. And so all the partners came together. We came and forged an MOU, and all of the partners really worked day and night to come up with what we now call as the online healthcare upskilling program for our healthcare workers.
What are we doing as governments to ensure that the healthcare workers are truly taken care of, their issues are fully addressed, and they are able to communicate and come up with ways and means of dealing with this pandemic? I think it is absolutely important that this is taken as a priority. This is put as a first priority currently that we're supposed to deal with. The things that we should be looking at are hospitals are becoming full, and patients sometimes have to be sent away. Because if you can't give them proper attention, then why would you keep the patients in hospital? Because they would even endanger those who are not in hospital.